Okay. Hey guys, my name is Karina, and I am one of the leaders here at our clinic.
Hi, I'm Andrea.
I'm Chris.
Hi,
I'm
I'm
also part of
Julia.
the team. Oh, Julia. Yeah.
Okay. Welcome. So today we're going to be talking about the community health-based theory, and so today we're going to be explaining that.
So basically, I thought that the main takeaways from this theory was that it's mostly concerned with the overall health of the community and working together in collaboration with providers, community members, and just really trying to make it a better place. And I thought one big point was they talked a lot about respect and how respecting others and caring for them as a whole really kind of enforces the collaboration within the community. So.
Also with this theory, like nurses, by understanding their community better, they can also help understand the patient and give more holistic care, which is one of the goals for this middle range theory. And so some important concepts that we also want to touch on for our middle range theory is the group we all agreed that the group should participate in community participation, and by being a nurse and using this practice, you understand that you have to understand what community you're serving as well.
I thought another interesting topic related to this theory that Parker et al. 2020 brought up in the chapter about community nursing practice model is that the foundation of it is based on the World Health Organization, and it kind of talks about the community and access to healthcare and other needs of the community, how essential certain aspects are, the community participation, empowerment, and intersectoral collaboration, which I think kind of brings it back to working as a whole and addressing different parts of the community where needs might need to be met and things need to be changed.
I kind of thought it was interesting kind of going back on what Andrea said at first. I felt like that with this model, what kind of came to mind was the ability to adapt to the needs of the community. I kind of thought of how the community, it seems like that this theory really focuses on the community working together and knitting together their needs to help better care for their populations.
Right, and acknowledging that like people, they're empowered by understanding that they have choices, and the choices that they have are influenced by what's necessary for their well-being and the priorities in their daily lives and family. And I feel like that involves the patients more in their own care because they feel like they have a say in it. And yeah, it's holistic and it presents the nursing and authentically, not so much as in the medical aspect, but more so in like the caring aspect of it. Kind of like and being receptive to different choices within different cultures and different customs, and just being just like we had reference to the holistic approach. So there's not like one set medical standard way to do it, but just everything and everyone, patient and nurses involved, and the community and the family, they all take part in they all play an essential role in the health outcome of the patient.
Also, I think by using this theory too, I think not only is our patient empowered, but we as nurses become empowered too, because we understand our patients on a deeper level. And I think that really says something for when we're giving care. So our next question that we're going to talk about is what patient population would be addressed by this theory. Overall, I would think it's community members that can correlate to each other and that can relate to each other. And so one of these communities might be underdeserved communities. So they may all, not all of them, but a majority of them may experience some struggles with financials or healthcare or access to education. So that's just one of the patient populations that could be addressed by this theory.
I think another patient population is children, and how education is working with the healthcare system. Something that was brought up by in the book by Parker et al. 2020 was that nurses in like public schools and other areas of education are really helpful in taking care of children who may not have access to regular like clinical visits with their primary care, and also assessing things like health literacy and other areas where the community, especially like with children, could be struggling.
Right, and that kind of ties into the environment aspect where the reparative, it's also stated in the same by Parker, King, and Berry, 2020. The reparative powers of the patient are indicated by the social settings that contribute to health and illness, such as those identified as social determinants of health by the World Health Organization. So it's not just the immediate effects of air, odors, noise, and warmth. It's, even the school environment. I know it's part of education, but socially, it's a social setting, and then that also contributes to the health and even the preconceived notions of health that the patients have coming into the clinic.
Yeah, I think going off of that, like we were talking about with the first question, how this theory really focuses on respect, and how Karina was saying it focuses on empowerment. I think when I was reading about the theory, a big thing that came to mind was just kind of like open-mindedness and like wholeness of the theory. Like you were saying, Chris, about being open-minded to other cultures. And I think that if we do target, well, we are targeting the underprivileged population, this kind of just ties all of those concepts together, because like Karina was saying, this is a needy population, especially with children. This is a vulnerable population. And I think that these are going to be the people that need the help that we could provide the most.
And that takes us into what tool our group decided on that we're going to be doing. So we decided that we would be doing essentially kind of like a home health survey. When our patients come into our clinic, we're going to give them a form, a survey that they can fill out. And essentially this clinic is for underdeserved populations and for people in those areas as well. And so these questions on the survey will purely be assessment questions. So some of the questions may be, do you feel safe doing X activity at home? Do you feel safe? Do you feel like you have a safe amount of food at home? Do you feel like you are safe with the people you live with at home? Do you always have a meal available at home? Do you have a solid support system who you can openly talk to? We had some other ideas for questions as well, but those are just our broad general census of what we were thinking. So for these questions, we kind of did want them to be a little bit more close-ended as well. That way we are able to score them. And so essentially what we were thinking as a group, as if they answered yes to 2 or 3 more questions, just depending on what we ask, that we can sign that patient up for an education before they leave, either a psych consult or a social work consult. And granted, we know, like, I know these things cost money, but at the same time, if we don't fix these trauma issues or these home health issues that are vital for people now, we're not going to be able to give them or ensure that they'll be able to live healthy lives for the rest of their lives.
Right. In that
Kind
sense,
of going off of that. Oh, go ahead, Chris.
No, in that sense, it has to be a more of a focus survey, so that we can identify specifically what the needs are, and if they're being addressed at all, if there are any efforts being made for them to be addressed, and that way we can know who to consult to have in a follow-up with the patient.
So looking at what the Parker article, the 2020 article said, one thing that they did say was categories of service in the core consist of the design of coordination of care, including primary care, health promotion, health screening, and early intervention, as well as tertiary prevention. I think we targeted a lot of that in our questions. I think there's even questions that we ask thinking about primary prevention, and kind of asking about how can we solve this problem before it actually becomes a problem and happens. So I think that a lot of the questions we have, like Karina was saying, are open-ended questions. They're very generalized questions. They could be for people who are already struggling with something. They could be for people who are at risk to struggle with something. So I really like how we created a tool that is for all types of people that could be struggling with the same or similar issue at a different time.
Yeah, what I really like about our tool, we used from Parker and other authors from 2008, is they really talk about this theory being is for patients to be the expert knower. And essentially that is so true. Nobody knows your body like yourself. And I think by understanding that as a nurse and as a community health nurse especially, we can give better care to our patients and listen when they are telling us or when they're filling out these surveys of whether yes or no they don't feel safe at home. And so, you know, they know whether they feel safe or not, even if it may not sound unsafe to us. To them, it's unsafe for a reason. So as nurses, this also teaches us to listen to our patients as well and to be more holistic about how we practice with them.
I think going off of what you guys said too, like this assessment tool really relates back to the theory, especially being community-based, like unsafe environments and access to food and healthcare are like some of the biggest topics there are when it comes to community and how well equipped it is to deal with problems like this. So I think this is kind of a good way to get a better understanding of the population wherever the site is.
Right, and then in some cases, the community may not be the best, but you have to ask whether the patient feels safe in there, because the community may not be the best, but the patient feels safe there, then there's not a problem. Because I mean, there's some communities aren't the best, and kids still walk to school in groups, and the kids don't feel unsafe because they're familiar with everyone in the community. So that kind of just, it kind of helps to kind of like break that assumption that just because you live in a bad neighborhood or in a bad community, you don't necessarily feel unsafe within it. And that would help us identify, like, okay, do you feel unsafe? And that way we can kind of divert resources only to those who don't feel unsafe, whereas everyone that comes into the clinic, just because the community itself is deemed unsafe.
I think Chris makes a really good point, and it definitely relates to from Charlotte Berry from 2007. By understanding the values of patients, so by understanding that yes, they do feel that safe value at home, we can better empower them too. Or if they don't feel safe at home, we can better give them the access to become empowered. And that's something that this survey and can do for us as nurses to help understand.
Mm-hmm.
So also when we're filling out the survey for instructions, we want to tell our patients that we want them to fill it out openly and honestly.
And I think part of that, having it be a self-completed survey, is kind of nice to let them by themselves fill it out instead of having to talk about their experiences to a person face to face, because I know that can be hard for some people, especially if they've gone through traumatic events. So kind of just leaving it as a yes or no question and possibly being able to talk about it more in depth later if it is a problem.
Right, because I know they might be afraid to answer honestly if you're asking the question, and then you can let the patient know this is going to go into the right person's hands, that it's going to be able to help you and make a difference. You know, I'm going to pass this on. It's not going to stop end here with me. It's, you know, it's a team effort, and we have people who are qualified to help you based on how you answer the survey. So answer as honestly as you can, and let them answer it on their own so they don't feel pressured into saying the quote unquote right thing or giving the right answer, which what they might feel the nurse wants us to hear, like the healthy answer. Then that way they can answer more honestly and let us know whether really they feel unsafe or they feel unhealthy, or, you know, be vulnerable and not be afraid to be vulnerable and show their vulnerability, because we want to address them.
And I think having it handed out before a visit, or like while they're waiting in the waiting room or the room for a provider or a nurse to come in, allows the care team to kind of look it over and kind of assess what needs they may be in need of, like a consult, like Karina, you said, or maybe even education or something along those lines.
Yeah, that actually leads me into our next question of like when, I mean, we kind of already touched on this, but would you need to follow up on questions and when? So absolutely, this survey is totally a follow-up kind of survey. And I mean, but maybe not, you know, like Chris was saying, so they maybe feel totally fine at home, but that's something that even if we don't follow up on, we'll put for our records like, yep, they have a good home life or something, you know, or like a good support system at home.
Right, and I feel like it would be more of an urgent follow-up depending on their score and what that would indicate. Like a low score equals higher risk for poor patient outcome, poor health outcome, based on home health and based on the answers to the survey. So it all varies depending on the answers and, right, whether they feel safe or not within their own environment.
Right. So to end our discussion, we'll each just describe how we would, or what experience of care would this patient group have if we use this tool in practice. So for me, I think this would be a great tool in determining what trauma has happened for a child and how we can essentially stop it from happening and give them a safe outcome and be the change in their life that turns it around. And just by doing this small survey could maybe do that for us. So that's something I would definitely use in my practice.
Right, it helps us to kind of step away from that medically medical aspect of nursing. It's more of patient to nurse interaction, more kind of like what you signed up for, to help patients directly and advocate for them and make sure that they're safe and they're healthy and they feel that way. Not just, it's kind of stepping away from giving them their meds and checking their vitals, and it's how do you feel now? Like, how can you describe your own health? And emotionally, they can get more in depth with that. Like, how does living where you live make you feel? How do you think that affects your health? So it's not so much as, oh, I came in with this illness, let's address that specifically. It's kind of like, well, kind of how are you doing at home, sort of. It's more of a personal approach to nursing than a more distant, cold medical approach. And I feel like that's also needed because, like with this whole COVID thing, it's like a lot of patients are weary of going to see nurses and doctors, and I feel like if there's more personable approach, then they'll be more willing to go and seek out help. And this is a very personable type of theory and model to patient care.
I think this patient
I
group.
think that. Oh, go ahead.
Okay, sorry. I think that the patient group would really benefit from it. And also as nurses, we can benefit and learn how to better provide care and like things to be on the lookout for. I mean, if your patient comes in and answers yes to a bunch of these questions, like looking for unexplained injuries, just kind of like being able to better provide more customized, I guess you could say, care to your patient, like make it individual and be on the lookout for those types of things and be preventative as well.
Mm-hmm.
Yeah, I think I really liked, Chris, what you were talking about, how a lot of nurses, I guess not a lot of nurses, but in healthcare, people seem to have strayed away since COVID and they've been more fearful, and how it's important to provide and remember that we're taught that nursing is personal. And I think too, what always helps me is empathy. It's something that I've always found really useful ever since I've kind of started like my healthcare journey. I think that empathy just helps us, and I think that we need to remain, when we are asking these questions, we just need to remain empathetic. We need to put ourselves in the patient's shoes, and ultimately it's going to help us better understand what our patient needs. It's going to, if we have empathy, it's going to help us to ease the patient and calm their anxieties, and it's going to show that we're there for them and we're there to keep them safe, and that we're taking the time to discuss their problems. Even if it's something completely outside of this scale, I think it's really important to take the time to discuss patient needs. And I mean, ultimately, when people provide empathetic nursing care, I think it just provides for better patient care, because it gives you a better perspective of what the patient's going through, and just how to better care for them. And like Andrea was saying, by personalizing and creating individualized care.
Mm-hmm.
Absolutely. Well, thank you for listening to our discussion, and I hope you have a great night.
Thank you.
Thanks.